A new report out today says a simple shot and some extra testing could help save millions of women's lives.
And joining us now to share this new research is health anchor Liz Bonus. Hey, Liz.
Yeah, our prayers go out to Mom and so many stuck in that snow. We do want to share this new research today. It's been released overnight. It found more vaccinations and more testing could prevent millions of women from ever being diagnosed with cervical cancer. It is known to be one of the most preventable cancers. Now, researchers in this study say a big increase in both screening and vaccinations could prevent up to 13 million cases of cervical cancer worldwide within the next 50 years. Specialists at the Cleveland Clinic that reviewed this study and released this video say it's published in the journal Lancet. It's now suggested all women be screened for cervical cancer beginning in their early 20s. If you catch precancerous cells early, you can prevent this cancer from ever fully developing in the body. Researchers say a significant increase in both cervical screening and HPV vaccinations worldwide could potentially eliminate cervical cancer as a major public health problem. This could happen in up to 82% of the world's countries by the year 2100, and in higher income countries such as the United States, it could possibly completely eliminate this cancer. That could happen in the next 25 to 40 years. Now, in contrast, they say without those prevention programs, as many as 40 million cervical cancer cases could be diagnosed over the next 50 years. Because you're looking at something you've given it a vaccine for now, and then it prevents years later, you know, when you might come in contact with the HPV virus that causes that. The other thing that's really interesting, though, is that cervical cancer now is the 4th leading cancer in women. We don't hear about it like the others. So we're learning, you know, it's not just here, it's worldwide, but we're learning a lot about it, and this is important information to share.
Okay, but you can't get the vaccination if you're, only if you're young.
You can get it. I mean, you could get it at any age. The studies were done initially. You want to get people before they get sexually active. It's, you know, a virus that could be transmitted sexually. There are other causes, but that's probably the main one. So they always start with the guidelines of like 15 to 24. But just like with the other cancers now, they're starting to extend it that maybe up to age 45 might be beneficial.
Interesting.
It is
learning
really
so much more. It's so important.
So important. We could completely wipe this out if we know that, you know, there's things we could do and stop
a hard one to recognize. So even so important.
Yeah, and standard screening doesn't always happen for it either. So we are back.